folliculitis, and if that is deep, then will be called furuncle. But if there are more than two heads, then it is called carbuncle. You can see here. So this is carbuncle. If there are multiple heads in a boil, the lesion is called a carbuncle. Okay, and if one head, then furuncle. That would be deep. Which type of lesion is this? So ecthyma. Okay. So ecthyma is a skin infection characterized by crusted sores beneath which ulcers form. It is a deep form of impetigo, and they resolve slowly, leaving a scar. Okay. So this is impetigo as well. Okay, but this is chronic, which leaves scars. Characterized by crusted sores beneath which ulcers form. Okay, it is a deep form of impetigo. Okay, so deep form of impetigo leaves scarring. Okay, now which type of lesion is this? You can see here rolled edges, pearly rolled edges. So most common type, it's a basal cell carcinoma. Okay, most commonly type of facial skin cancer, shiny or pearly nodule with a smooth surface, may have central depression or ulceration, so its edges appear rolled. Blood vessels cross its surface. You can see here blood vessels crossing the surface. What type of lesion is this? It's erysipelas. Okay, is a superficial form of cellulitis. Okay, affects the upper dermis and extends into the superficial cutaneous lymphatics. The affected skin has a very sharp raised border. It is bright red, firm and swollen. Okay, very sharp raised border. You can see here sharp border. Okay, so what type of lesion is this? This is cellulitis. Okay, you can see here margins are dull here, so this is cellulitis, but here margins are sharp. This is erysipelas. Okay, so this is cellulitis. Cellulitis is a common bacterial skin infection of the lower dermis and subcutaneous tissue. It results in a localized area of red, painful, swollen skin and systemic symptoms. The color is dull and margins are blurred. Okay, what type of lesion is this? Again, erythema. Okay, present a well-defined pink or brown patches, the fine scaling and superficial fissures. Mild itching may be present. The bacteria responsible for eczema are corynebacteria. Okay, so this is erythema. Okay, and this one was ecthyma, where it is. Yeah, this is ecthyma, and this is erythema. Okay, which type of lesion is this? You can see raised borders. So this is tuberculous leprosy. Okay, single anesthetic patch or plug with a raised border. So tuberculous leprosy. Which type of lesion is this? Lepromatous leprosy. Okay, widespread, symmetrical, shiny papules, nodules, and plugs are not anesthetic. Okay, tuberculous leprosy, single anesthetic patch, but lepromatous leprosy is not anesthetic. Okay, which type of lesion is this? This is a borderline leprosy. Okay, lepromatous leprosy, tuberculous leprosy. Tuberculous leprosy will be anesthetic. Lepromatous leprosy will not be anesthetic. Okay, and this is borderline leprosy. Okay, they are varying numbers of lesions. Okay, now which type of lesion is this? So these are common warts. You can see here these are common warts. Verruca vulgaris presents as a cauliflower-like papules with a rough papillomatous and hyperkeratotic surface. So these are common warts. Which type of lesion is this? So these are plain warts. You can see these are plain warts. So plain warts are typically multiple small flat-topped skin-colored papules located most commonly on the face, hands, and shins. Plain warts are mostly caused by human papilloma virus type 3 and 10. Okay. So plain warts 3 and 10 human papilloma virus. Plain warts has words are 10 PLAIN and WARTS. So these are 10 words, and human papilloma virus has 3 words. So 3 type 3 and 10 in plain warts. Okay, and so which type of lesion is this? Filiform. These are filiform warts. Okay, is a cluster of fine fronds emerging from a narrow pedicule base, usually found on the face. They are also described as digitate finger-like warts. Okay, so these are filiform warts. So which type of lesion is this? These are plantar warts. See here, these are plantar warts. Okay, so plantar warts, varicose plantaris includes tender inward growth on the soles, sometimes clusters of superficial, less painful mosaic warts. Plantar warts are typically tender with lateral and direct pressure, are surrounded by yellow hyperkeratotic callus-like skin showing asynctonated skin markings, but with discontinuation of the skin lines through the actual wart. Okay, so these are plantar warts. These are common warts. These are plain warts. These are filiform warts, and these are plantar warts. Which type of lesion is this? This is cone. Okay. So cone is clavus or heloma is inflamed and painful thickening of skin due to pressure. Common in those who wear tight shoes or pointed shoes. So this is common in them. So this is cone. It is painful. Okay. So this is callus. What is this? Which lesion is this? So this is callus. Okay, calluses are non-inflamed and painless thickening of skin due to pressure. Callus and tyloma is painless. These are painless. Okay, cone is painful, and callus is painless. Okay, which type of lesion is this? Herpes gingivostomatitis. Herpes gingivostomatitis is primary type 1 herpes simplex virus, most commonly present as a gingivostomatitis. Symptoms include fever, which may be high, restlessness, and excessive dribbling. Drinking and eating are painful, and the breath is foul. The gums are swollen and red and bleed easily. Whitish vesicles evolve to yellowish ulcers on the tongue, throat, and palate, and inside the cheeks. Local lymph glands are large and tender. Okay, so this is herpes gingivostomatitis. Which type of lesion is this? You can see here on the finger. So it is herpetic whitlow. Herpetic whitlow. So here is the explanation. Herpetic whitlow is also herpes simplex virus infection of the finger. Occurs following inoculation of the virus from primary orofacial or genital infections. Okay, so herpetic whitlow. This is molluscum contagious. Okay, skin colored, implicated. So a molluscus contagiosum. Which type of lesion is this? This is Milker's nodule. So ORIF. A solitary red rapidly growing papule less than 1 centimeter diameter, often on a hand, involves into a painful purple pustules, usually a history of close contact with sheep, which are from cows when trumped Milker's nodules. Okay, so this is ORIF. Which type of lesion is this? This is sunburn. Okay, suntan. You can see difference in skin color. So this is sunburn, suntan. And suntan increased melanin production due to excessive sun exposure. Okay, so which type of lesion is this? Addison's disease, darkening of the skin. In 95% of patients with Addison's disease, skin darkening is more prominent on pressure areas in skin folds or scars and within the mouth. Okay, so which type of lesion is this? So this is melasma, mask of pregnancy. Melasma, pattern macular symmetrical facial pigmentation. Okay. What type of lesion is this? Acanthosis nigricans, common in diabetics and hypothyroidism patients. Diffuse velvety thickening and hyperpigmentation, predominantly linked to a state of insulin resistance, diabetes, obesity. Okay, so acanthosis nigricans. What type of lesion is this? Vitiligo. Smooth defined white macular papules of no melanocytes, skin bright white under Wood's light. Skin bright white under Wood's light. Okay. Often symmetrical distribution and hair may be affected. What type of lesion is this? So this is albinism. You can see albinism. So in albinism, a rare genetic syndrome, autosomal recessive inheritance, melanocytes unable to produce skin, hair, eye pigments, white hair, pale skin, and pink eyes. Which type of lesion is this? These are comedonal acne with open comedones. Open comedones are black in color, white comedones are white in color. or closed comedones are white in color and open are black in color. Okay, so open comedones are blackheads are small follicles with dilated openings to the skin, allowing oxidation of the debris within the follicle, leading to the black color. What type of lesion is this? So this is comedomal acne with closed comedones. So these are white in color. Closed comedones are white hairs, small black follicles, the contents of which are not exposed to the skin. That's why they are white. Which type of lesion is this? Papulopustular acne. Papulopustular acne can be predominantly inflammatory with papule and pustules. And which type of lesion is this? Nodulocystic acne. You can see nodulocystic acne. Nodulocystic acne. Okay, nodular acne form when bacteria get trapped inside the Golgi pore. This may lead to an infection that affects the deeper layer of the skin. The infection can cause inflammation at deep skin layers, creating hard nodules and cysts. Okay, so nodulocystic acne. Which type of lesion is this? See here. So acne rosacea, you can see pink colored bilateral. So acne rosacea. Cutaneous features of acne rosacea include transient recurrent erythema, flushing, persistent facial erythema, telangiectasia, inflammatory papules and pustules, papulopustular. Okay, so acne rosacea. What type of lesion is this? Rhinopyma. Rhinopyma. One of main complications of untreated rosacea is rhinopyma. Okay, rhinopyma. It causes the nose to enlarge and become red, bumpy, and bulbous. Red, bumpy, and bulbous rhinopyma. What type of lesion is this? Contact dermatitis. Okay, contact dermatitis is an itchy rash caused by direct contact with a substance or an allergic reaction to it. Okay, could be due to any soap, any makeup, or anything, you know. Which type of lesion is this? SLE. Okay, butterfly rash. Telltale sign of lupus is a butterfly shaped rash across the cheeks and bridge of the nose, sparing nasolabial folds. Okay, you can see nasolabial folds are spared. So this is SLE, common in SLE. Which type of lesion is this? Seborrheic dermatitis. You can see seborrheic dermatitis. Seborrheic characteristically the scale is yellowish and greasy or white and brown like associated with a variable annular or annular pale pink to bright red patches. Itching tends to be absent or mild. Okay, so seborrheic dermatitis. Which type of lesion is this? You can see here around the oral cavity. So it is perioral around the oral cavity dermatitis. Perioral dermatitis. So dermatitis is a red rash that cycles the mouth. The skin can be scaly, dry, and flasky with swollen and plump bumps called papules. Perioral dermatitis can look like acne and is often mistaken for it. Okay, so perioral dermatitis. Which type of lesion is this? See. So acne fulminans. Okay, so acne fulminans. So this is emergency, you know. Acute fulminans seen in adolescents, boys. Severe acne associated with fever, arthritis, and vasculitis. Okay, fever, arthritis, and vasculitis, acne fulminans.